It's difficult enough for a Conservative administration, really difficult for a Labour government, as Keir Starmer and Liz Kendall finding out. The time has come to think much more radically and to think about a kind of very sweeping reform, reconstructing the whole welfare system. We're in a really, really bad place.
Hello and welcome to the Institute of Economic Affairs podcast. I'm Callum Price, Director of Communications here, and today I'm joined by our Senior Education Fellow, Dr. Steve Davies. So Steve is written for Insider, which you can find at insider.iea.org.uk, our Substack output, on alternatives to state welfare spending. Now, just to set the context to this before we go into it, the problem with state welfare spending in the UK at the moment is that it is effectively vast and growing. It accounts for approximately 12% of government expenditure that's minus pensions and healthcare, which we're going to avoid today, although because they are their own problems in and of themselves. It's a welfare bill that is ballooning. Incapacity and disability benefits are expected to reach 100 billion by 2030 and are already up 25% on 2019. So, Steve, could you just walk us through sort of what is the problem here? What's the scale of the problem, and why has it gotten so bad?
Well, the problem really, as you said in your introductory remarks, is that you have a very large budget already, and it's growing very, very rapidly. And since the pandemic, particularly, it has really taken off. The growth has become explosive, essentially. Now, what are we talking about here? The crucial thing to recognize is that the benefits that are increasing so rapidly and where the big problem lies are not primarily the classic contributory benefits of the old Beveridge system, sickness benefit and unemployment benefit. In particular, they're not really unemployment benefit. There's currently about 1.6 million people registered unemployed who are getting that benefit, which, given the way our economy works, is actually pretty close to full employment. The problem is with the different set of benefits that were always around, but were massively expanded under Gordon Brown when he was Chancellor, particularly a whole range of income supplements, which were then consolidated under the coalition government into universal credit, so there's that benefit. And in addition to that, housing benefit, and also a whole range of benefits given, like PIPs, for example, mobility scheme for people who are unable to work for some reason or another. So essentially, what you've got is supplements to those who are in work but on low income, a very large category, which is what universal credit is basically, along with the so-called passport benefits linked to them, the benefits you get because you're on UC, which includes, crucially, housing benefit in many cases, and also the benefits given to people who are unable to work. They or at least officially say that they're unable to work. One of the problems is we don't know. It's very hard to find out what proportion of the people who are in these benefits are really genuinely unable to work. It's certainly larger than many people imagine, but it's very unlikely to be the total amount of people who receive these benefits. And these claims are increasing dramatically. And so Liz Kendall, the Secretary of State, has said very openly several times that the growth of these benefits, particularly the incapacity benefits, non-working benefits, is unsustainable. The Treasury and the tax base simply cannot take it. And this system is not only, though, very expensive, the flip side of the problem is that it doesn't actually really help the people who are getting it. They're stuck and trapped in a condition of dependency upon state benefits because most of these benefits are means tested or qualification related. And what that means is that if you lose the qualification or you take on paid work, you lose most of that benefit. So you're facing effectively an 80% of its universal credit marginal tax rate, which is not surprisingly a major disincentive. And so these benefits create enormously damaging incentives towards not working or not working anything other than the maximum amount you can work before you lose your qualification. And they trap people in a condition where they're on what is still a low income, facing rising basic living costs, and facing the prospect of actually being worse off if they try to get out of that state. So this is socially and personally incredibly destructive. But not surprisingly, the people who get these benefits are terrified of the prospect of losing them because they've now come to depend upon them. So we're in a really, really bad place.
And it's quite surprising, isn't it? Because I think often the sort of caricature of the welfare system is, certainly in maybe years gone by, is the idea of sort of people signing onto the dole because they can't be bothered to work. But actually, when you drill down into it, it's people who either, as you've said, are on work, are in work, or it's people who qualify for certain payments who then, when you speak to them, and there are documentaries and anecdotal evidence and all sorts, when you speak to these people who would like to go back to work, but it would frankly just cost them too much for what they're getting. So how have we sort of got into this state?
We've got into it in the classic way that many government programs work, through starting off with good intentions, but not thinking through what the logical implications or necessary consequences of the steps we took would be. So Gordon Brown's original thinking, which, made a lot of sense, you could say, and was, I don't know, had good intentions, was that it was better for people to be in work, even if on low pay, than simply being unemployed. And so Gordon Brown wanted to encourage people to take up work, even if it was at low pay. However, the problem was, of course, that they were on low pay, which relates to another structural problem in the British economy, which is that we have low labour force productivity. That's a whole big issue that we don't have time to go into here. So his solution, and the solution of this system we have, is to top up that low pay so that people have a higher income up to a certain amount. Now, the problem with that, though, is that it inevitably creates the kind of perverse incentives that I just described. Had the effect, therefore, of trapping people in a condition of depending upon these income transfers and not being able to increase the amount they work or even move to higher paid work by acquiring extra skills and things of that sort without doing it. The additional problem is that there has been a consistent increase in the number of people who say that they're not able to work. Now, some of this may indeed be a case of finding that it's easier to do that in some parts of the country than to find employment or to move to another part of the country. This is yet again an area where the problem of housing is making things much, much worse. There are many people who could find work if they could move to another part of the country, but they can't do that because of housing costs. That means that they're geographically stuck in a part of the country where there is very little in the way of reasonably paid employment, and therefore the incentive to say that you can't work becomes very, very powerful. In addition, though, there are many, many people who are genuinely unable to work because there's been an explosive growth in mental health problems, particularly amongst the young, in the last 11 to 12 years, since roughly 2014. Quite why this is, nobody is sure yet, but it's a real phenomenon, as anyone who works with young people can tell you. And there's also a problem of people, particularly in their 50s, who are physically in bad shape for one reason or another. And again, they can maybe work, but it's very difficult for them to work full time or to do certain kinds of work. And given that, the easiest and simplest thing for them to do in many cases is to apply for an incapacity benefit of some kind. So that there's a whole series of problems that have arisen, partly because of structural changes in the British economy and changes in British society, many of which I think hard to explain. We don't know quite why they're happening, but also because of the inevitable results of having a welfare system built around supplements to low pay, which are means tested. That is always going to create the problems that you have here. However, they are means tested because people, for good reasons, don't want tax money going to people who are well off. So the alternative of universal benefits is very unpopular and also just ridiculously expensive because it means giving large amounts of money to, well, not billionaires perhaps, but people who are on average or above average incomes, which again doesn't make sense.
So what's the solution here? Just this week, the context that we're speaking in is, I mean, today there's been a vote, or that there's been talk of a rebellion of the government's plans to make some reforms to the system to try and claw back, I think, about £5 billion, which is small in the grand scheme of things, but a large rebellion from the government's own benches, perhaps illustrating that this isn't an easy problem to solve, which won't be a surprise to any of our listeners or viewers. So what, on one side, lots of people might say, well, just throw more money at the problem, and on the other side, we might say be more targeted, cut benefits where we can. What are the solutions on offer so far that people
Well,
often go to?
the solutions that are on offer generally are to reform the system in some way, to make technocratic tweaks to the rules, the entitlements, the levels of payment, things of that sort. Now, there are two problems, well, there are several problems with that. One of them, which you've alluded to, is that this is politically very, very difficult. It's difficult enough for a Conservative administration, really difficult for a Labour government, as Keir Starmer and Liz Kendall finding out. But there are other problems as well. One of them is that almost any attempt to tweak or amend the system is going to typically have the effect of leading to a displacement of the demand for these benefits into other areas. So one of the areas that has grown explosively recently is payment for special educational needs. Now that happens because a few years ago, the Treasury became alarmed by the amount of money that was being spent on special educational needs, people who'd got a certification, a sign-off that their child required extra assistance at school. And so they tightened up the process for that considerably. And what it had the effect of displacing people onto a different program, which is actually more expensive. So the end result is that people have instead gone through a much more difficult and elaborate program of being evaluated, but it's ended up increasing public spending. And so attempts to prune the system or tweak it in some way often have the perverse result of actually increasing spending while at the same time making the system itself more intrusive, more difficult to navigate, and hostile, if you will, for the people who are caught up in it. So one of the things that happened a few years ago was that there was a major reform of Job Centre Plus. And what that did was to make the whole process of being registered for work at a job centre so unpleasant and so taxing for the people involved that a lot of them decided they just weren't going to bother. They were going to apply for things like PIP as a way of not having to register for the Job Centre Plus program. So you're in a situation, I think, where even what appears to be quite sweeping reforms of the existing system are just not going to cut the mustard. They're going to bring you a lot of political pain, as the government is finding out, but they won't actually necessarily address the problem and help either the Treasury or the unfortunate people who are stuck in this welfare trap of welfare dependency. So I think the time has come to think much more radically and to think about a kind of very sweeping reform, reconstructing the whole welfare system probably, which is an enormous ask, of course. But we're now in such a bad place that I think probably this is, in some point in the not too distant future, what we, the political community, the state, if you will, is going to have to do.
Without getting into maybe the exact detail of what that might look like, because I don't think we've quite got the time, nor are all the plans or ideas in place yet. But what would the principles of that system be? Obviously, the system at the moment is structurally unsound because it is overly centralised, overly prescriptive, overly managerial. So what sort of principles would underline a better alternative to you?
It would be interesting. I think what we historically, when we've been confronted with welfare crises like this, we've had things like royal commissions. I mean, if you want to go a long way back, when the old poor law was on the verge of collapse in the 1820s, we had a royal commission which led to the radical reform of the poor law in 1834. And this, if it was done properly, would be a way for having what you might call a big national conversation where perhaps through the political process we could agree on what the principles were going forward. And there are different ways you could do it. You could reorganize the welfare system in different ways. One of the things, though, which comes out of recent work that we have done, and which I allude to in the paper that you mentioned at the start, is that there's actually a surprising degree of agreement across the political spectrum, interestingly, and across the ideological spectrum, and not least amongst the people in charities and grassroots advocacy groups who are dealing with these problems on a day-to-day basis, as to what the problem is with the existing system, which is that it's very expensive. It is excessively bureaucratic. It is also highly managerial and rule bound. There's an obsession with process, and it's far too uniform and centralized. Now, from that, you can deduce what principles most people would agree the alternative should be based upon, that it should be cost effective, i.e., actually enable people to lead a decent life without having to engage in a kind of complex and elaborate bureaucratic procedure and trap themselves in a position where they can't improve their own life. Something which is much more localized and which takes much more account of local knowledge and local experience, because it is vanishingly unlikely that a welfare program is going to address the problems of both somebody living in, say, northeast England in a former mining area and somebody living in central London or the eastern parts of London, or for that matter, somebody living in a seaside resort or in a rural area where rural employment has basically collapsed for some reason or other. It is extraordinary to think, actually, you even imagine that there's some kind of one-size-fits-all highly complex rule-bound system that can work just as well for everybody everywhere. The degree of granularity, to use the jargon term, is so great that that would be almost impossible. And so you would need local knowledge, and you'd also need a great deal more, if you like, action by the people involved themselves. I think not having so much of the state acting on people as people through various means helping themselves, maybe with financial assistance indirectly from the state, but without as many strings as the Treasury currently attaches to it. What you would have to do as well, of course, and put this to one side, but it's worth making this point, you would have to address certain other problems which are making this whole welfare situation much, much worse, notably the cripplingly high cost of housing and the very high cost of energy. Those are two things which relate to different areas of public policy where misguided policy is making the problems of not just the poor, but of everybody actually much, much worse than they need be.
So we can add this to the long list of other problems that, yes, that might be, not if not solved, then greatly improved by energy and housing reform.
Oh, absolutely.
So what we're talking about here is basically a complete alternative to the current state-run system.
Yes.
What role do you see? In fact, first, before we go there, let's talk about what does that therefore mean a sort of a market-based approach?
Not necessarily, because when people talk about a market-based approach, what they typically mean is one where it's run on a kind of commercial basis, or on it's profit-seeking businesses, if you like, which are the main agencies. And that's not the appropriate model to apply here. In fact, one of the problems with a lot of the system that we have at the moment is the insistence by the Treasury that people adopt what are essentially business models or buzzwords and ideas derived from, I think, a very cursory reading of management science texts very often. So, for example, people who voluntary agencies and organizations who apply for funding from the government now are frequently told, for example, that they have to do a whole range of things while being innovative. Now, this is clearly because somebody has read, I don't know, a Jack Welch memoir or something like that. But that's just not the kind of appropriate mindset or methodology for this. And we're not dealing with a kind of activity or problem where that sort of model is appropriate. So talking about an alternative to the state does not mean, in this context, moving towards private insurance or profit of the conventional kind or profit-driven private sector activity. It does mean moving towards mechanisms and institutions which are non-state institutions, however. That's the kind of route I think that we need to explore, along perhaps with the state doing certain other things that will alleviate the problem, but not what it's doing at the moment.
So then what role would there be for the state in such a, presumably there would still be a role for the state in some way. What would that look?
Yes, definitely. I think there are two possible different models, and I think we can have a kind of debate about which one of these is better. One of them is for the state to provide quite simply and literally a safety net. In other words, a minimal form of state welfare, the goal or aim of which is to prevent people quite literally dying in the street, outright destitution, but which would be tied to quite strict criteria in terms of what people can and can't do in order to qualify for that. That would be a kind of very minimal state provision. And then what you would rely upon is non-state provision for picking up the slack, if you will, doing the other things that very minimal level of, as I say, safety net designed to protect people who've quite literally fallen off the wire. Their personal life has gone to pieces for some reason, or something that really bad has happened to them. The other sort of model is known as the universal basic service model. Now, the problem I have with that is more to do with the civil liberties aspect of it, if it's not done correctly, than the economic side. And that's a system where the state ensures that certain essential services or products are available at a very low cost, a cost which means that pretty much everyone can afford to get them, even if they're on very low income, so that you are able to live a minimally decent life, a life which enables you to participate in society, because these things are available to you. Now, that doesn't necessarily mean that the state provides them free of charge. In fact, that would be very foolish. Almost certainly there should be charges to regulate the demand, but that's the other way of doing it. So those two kind of alternatives, if you will, a minimal state safety net, or the state providing certain services at a charge, which means that virtually everyone can access them, they're not necessarily incompatible. You can actually combine the two. You probably would need to actually. The question would then be which one should be the predominant one, and you can argue then about which one you want to give the greater weight to. If you are going to go down that second route, what you must not do is give the state a monopoly of those services. We can see how damaging that is in healthcare, for example, where there's a de facto monopoly because the service is provided free at the point of use, and that has not worked very well at all. But on the other hand, it probably would be quite useful for the state to do certain things like that, as it does, for example, with a lot of infrastructure. Now, the question then is, well, what about the things that come beyond that? What about the people who are on low income, the kind of people, for example, who may have health problems, disability problems? How do you deal with them? And that's where I think you need to move to the other part of this proposed radical way of new thinking, which is to look at non-state and non-commercial forms of voluntary and collective action, through which society, acting at a local level through voluntary associations and groups, can address social problems in a very much more decentralized, granular local way. David Cameron toyed around with these ideas in a very vague way with his notions of the big society when he first became Prime Minister, but it very rapidly fell by the wayside. It was pretty much forgotten, and people like Philip Blond and Jesse Norman, who had been interested in this idea, nothing became of the ideas they floated. But I think that's something that we do need to explore.
And how is that, in your piece, you point out that that's different, and that it's not the same as, say, charity?
No, it's not.
Could you walk us through what the sort of separation of those two things is?
The difference is very clear and straightforward. Charity or philanthropy is where people who are more fortunate, have more assets, more income, voluntarily give from their money or indeed their time in order to assist those who are worse off than themselves. Nothing wrong with that. That is a good thing to do. And our ancestors used to spend a lot more of their income and time on doing that than we do now. But there are problems with it, not least that it's seen as being demeaning to receive charity, and there's a kind of resentment of what you might call the kind of condescending or supercilious nature of a lot of philanthropy. It's seen as undermining the dignity of the recipient, basically. So what I'm talking about here is mutual aid. And mutual aid is collective self-help, where people who individually, maybe in very difficult places, have very little disposable income, pool their resources, time and knowledge, and maybe get assistance from those with more time and resources to help themselves collectively, to provide services for themselves collectively, and to address common problems that they share. Now, that used to be a major feature of most modern societies here in the UK, in Germany, in France, in the United States, where they call it fraternalism usually. It was a major aspect of civil society up until really the 1950s, I would say, as late as then. And it's something I think we should revive. And it's not charity. That's important to realize. This is something where the action is controlled by the people who receive it. So this is a case where even though there may be assistance given to them, it's actually people who are, if you like, in a difficult situation, helping themselves and protecting themselves against adversity and addressing the common problems that they have through their own action, which they control.
And the incentives to do that presumably would be that they would benefit from the services or the support that they're offering themselves. It would be a sort of a give and get.
The point is, crucially, these would be rights or entitlements which you acquire by taking part in the process by which they're delivered, by belonging to the voluntary association or body that provides them. It also makes use of the tacit and dispersed knowledge of the mass of the population. It's much easier for somebody in a locality to know exactly what the problems that a particular individual faces are and whether one individual or another is actually a genuinely hard case or someone who is trying it on. Or maybe in a very common situation, they're not trying it on, but on the other hand, there are things they could do to help themselves, which maybe they're not doing, but you know what they are and you can help them do that. Very hard to do that through a bureaucratic, rule-bound process, but much easier to do if you have this kind of more civil society model of doing it, underpinned by the kind of state, if you like, base or floor that could take either of the forms that I mentioned.
So even though it's not a market-based approach necessarily, it still is a Hayekian approach, you could argue.
Very much so. Yes, it is. We tend to think that it's very easy to think that there are only two kind of basic forms of social action, which are market actions, profit-seeking, utility-maxing actions, and government actions through the political sphere. There's also this third sphere, if you will, the sphere of voluntary cooperative action and behavior. So as you say, it has a Hayekian aspect because it's making use of the tacit knowledge. It's voluntary, it's not state-based, but on the other hand, it's not commercial, market-based either. It's a whole area of human life that we tend to ignore. The family is part of it as well, by the way, of course. We should not forget that. The degree to which families help each other and provide social support for each other is enormously underestimated and overlooked, I think, in contemporary conversations and discussions.
Absolutely. And just before we wrap up, because we're already well over time, but this has been fascinating. But what do you see as the road to this sort of more radical way of thinking? And what happens if we don't go down that road and we get it wrong?
Well, if we don't go down this road, then I fear that the likely outcome is something like what actually happened in the historical episode I mentioned earlier, the 1834 Poor Law Amendment Act, which is the creation of a state welfare system, which is very punitive and controlling and extremely harsh, following a major financial crisis probably. And that would not be good for anyone, because we would be still having a very large amount of state spending, but it would now be extremely punitive and harsh on the recipients, even more than the existing system is, hard as it may be for some people who experience it to believe that. So that's where we will end up with. How do we get to where we are? I think there are three things that need to be done. One is simply for the basic idea and in many cases historical memory of this kind of approach to welfare problems to become more widely known and part of the conversation. There was a kind of start of this when David Cameron first became Prime Minister, as I said, but it petered out, and I think we need to revive that. The second thing is for the voluntary sector itself, because there is a large voluntary sector already out there, to free itself from its condition of dependency on the state, not least because the process by which they get money from the state at the moment is incredibly destructive for them. They spend virtually all of their time, in some cases, applying for grants from government and jumping through hoops to try and get money, and then, once they've got it, filling in forms and evaluation assessment forms for the Treasury. And this is incredibly destructive for them. And it pits one organisation, one locality against another, which is very, very damaging at a very level of personal relationships. So I think second element that needs to happen is for there to be a kind of realisation amongst the existing voluntary sector that they can't go on being just subcontractors for the government anymore. That this is not the way they should be going. It's destroying them. And the third element, I think, really is a political conversation. In other words, I think our political class needs to be much more honest about the problems that we face, and to realize that there are big problems and there are no easy solutions. Because at the moment, on the one hand, you have people saying, oh, the solution is easy, tax the rich more, spend more money, or even print more money and spend it. On the other hand, you have people saying, oh, we can deal with this, there are easy solutions, we can just cut the benefits without thinking any further. Or there are people saying, oh, it's an easy thing, we can just do these kind of managerial tweaks. None of those are actually reputable approaches, because they don't actually admit that there is a problem, the severity of the problem, and the fact that it is difficult and challenging but possible to address it. But until we admit that, there can't be a proper political conversation about exactly what the options are that we could take, which could be actually done, as opposed to existing in the world of fantasy.
Thank you very much, Steve. That is all we've got time for, I'm afraid. But if you want to read Steve's article, it will be linked in the description below, and you can find it on our Substack, insider.iea.org.uk. Until next time, thank you very much.